Hi everyone, welcome to this health literacy seminar. And I'd like to introduce Dr. Rosie Nash, who's here to talk to us today about her work in health literacy and the intersection with education and community. So Rosie is a senior lecturer in public health from the University of Tasmania. She's recently completed a Churchill Fellowship where she travelled the world talking to different people about health literacy. And she's also CEO of a new social enterprise called Health Lit for Everyone. And I'll hand over to Rosie to talk, and she'll talk for about, I don't know, 30-ish minutes probably now, and then we'll have time for some questions.
Right, great. Thanks, Rosie. Thanks, everyone. Thanks for joining me. So today I really wanted to explore with everyone the idea of an intersection between health, education and community. And that is really so that we can optimise Australia's health literacy. And I want to share with you a little bit of background as to why I've come to this point as well along the way. Feel free, we can have some great questions at the end. But if there's anything that's burning that you want to ask me, please feel free to ask in between. Progress this. So as Kirsten said, I'm here with three hats on really today. I'm here representing the Health Literacy and Equity Research Unit from the University of Tasmania, which I established about 5 years ago. Associate Professor Chandel Elmer is now leading our unit, and we're very fortunate to have her and her input there. I'm also here on behalf of the Winston Churchill Trust, and I don't know if any of you in the room have ever contemplated a Churchill Fellowship, but please have a look at their website. You don't have to actually be a researcher to apply. There's people that go away over to Europe and learn how to make cheese and also saddles. So if there's something that you're really passionate about and you want to make a difference, it has to have a community impact. So the work that you do has to be shown to be brought back to Australia and have a significant community impact. So please have a look and see what other people have been doing and the new knowledge that they've been bringing back to Australia. And finally, I'm here with another hat on, which is the CEO of Health Lit for Everyone. And this social enterprise was supported by the Invent Group at the University of Tasmania, who provided us with a small amount of funding to spin our research out into an entity. And a lot of other commercial groups are there to make money. We're actually all about social impact. So we wanted to make a difference and try and address some of the inequities that we see in the community. So this is our Health Literacy and Equity Research Unit's mission and vision, and we've had about 10 PhD candidates working alongside, helping us to achieve some of the goals that we had. We had a plan on a page, and we've been working through some of those things together. And we're really keen to collaborate more broadly with others in Australia doing work, but also internationally on health literacy research. So today I thought it's useful, because we know there's hundreds of definitions of health literacy, to provide a definition that sort of resonates for me. I'm not saying my definition is correct, but to start there with a definition of health literacy and how myself and some of my colleagues in Tasmania think about health literacy. Then I wanted to share with you my Churchill Fellowship motivation and the question I asked when I was in Europe visiting colleagues last year. And the findings and recommendations, I'm really keen to share those with you. It sounds from talking to Kirsten and Danny previously that there might be some overlap with, some of the research that's being done at the lab here and some of the insights that I had when I was in Europe. It could be helpful, I guess. And then finally, thinking about health literacy. So on this slide here, I've got for a better Tasmania, but actually more broadly, my context, and I'm positioned in Tasmania, but more broadly, health literacy obviously is really important for everyone living here in Australia. So this definition from Sarah T. Dodson is one that I find quite helpful. So the personal characteristics and social resources needed for individuals and communities in order to access, understand, appraise and use information about services to make decisions about health. I like that she also reinforces here that health literacy includes the capacity to communicate, assert and enact these decisions. But I think I'm probably speaking to the converted in the room anyway. to highlight that health literacy is much more than that. Health literacy, if we think about an onion and the work of McCormack et al., which talks about health literacy as a social ecological model, that we know that there's an individual in the middle of that onion. And so, for example, Olivia may have health literacy assets in her own right. She might be able to manage all of her health needs day to day. But others, so Fiona may not have, those health literacy assets that she requires. So those social supports around Fiona and also around Olivia are really important, and they can make a big difference. And that idea of distributed health literacy can support them to achieve the health goals that they may have. And then further in that onion, in the next set, part of the onion is the services. So those health services or community services or even schools can be health literacy responsive or not. And so being health literacy responsive as a service or an organisation is really important to ensure that they are adapting the service so that Fiona and Olivia can achieve their health literacy goals. So regardless of those individuals' assets in the centre of that onion, everyone can achieve their health goals. And so I like to think about health literacy in this way and acknowledge that it is a complex construct and there's a lot of interacting factors and actors at play. We saw in 2018 some of our international colleagues come out in the position statement to make it very clear to us that health literacy is a social determinant of health. In the past, we used to think about health literacy as, a subcomponent of education. And now we're very clear that health literacy is a social determinant of health and can have a massive impact on people's trajectory, their productivity. And in our research, looking specifically at children's health literacy, which we've been doing a fair bit of in Tasmania for the last 9 years, we've looked into the literature and seen that actually health literacy can determine someone's health outcomes. It's also got a bi-directional relationship with educational attainment, and then obviously has implications for social equity and productivity. And importantly, where I come from in Tasmania, we have a lot of challenges around educational attainment. We also have very poor health outcomes, and our health literacy is, on par with the Northern Territory. So we've got a lot of work to do, and to me, health literacy could be one of the silver bullets, the answers to this problem. And I think, again, I don't need to kind of convert the converted, but, developing health literacy earlier in the life course is essential if we're going to address adult health behaviours. But it's also important for those children right now to be equipped and given those health literacy assets. So this was a program called Health Lit for Kids that we developed back in 2016. So Associate Professor Chandel Elmer and I sat down at a learning and teaching event, and we were like, well, there's a lot of work being done for adults, but there was nothing at that stage to support children to develop health literacy in the school setting. At the time, some colleagues in Germany were also working in this space, but apart from that, there was not much else being done. And so we were really keen to see if we could co-design with some teachers in the school locally a health literacy program to develop the children's health literacy assets. So we have worked on this program and in 5 Tasmanian primary schools, and we have a very small amount of funding to explore or evaluate the program. We did co-design with our regional schools, so we worked with the teachers quite closely to ensure that the program was fit for purpose. And then what we did was we've published now 16 academic papers which outline the co-design process, the scoping review that we carried out, the international scoping review to inform the design or the protocol and the program logic model that sits behind our program. And also we've evaluated the program from the perspective of the teachers, the principals, the parents, the children. And so it was really important to us that we published and we shared all of this more broadly so that then we could convince government of the importance of this work, and it was making a big difference to these schools, these children and the teachers. And I don't have time today to go into all of our findings, unfortunately. But, you know, in summary, the teachers told us that children thought it was fun. They didn't feel like they were learning. There was a shift in the whole of school in the quantitative data for their health literacy responsiveness across the 5 schools. And in the positive direction, the teachers acknowledged that they felt more confident and competent as a result of the professional development we offered them. We had 3 workshops across a 12-month period, and we worked with them to develop an action plan. And the parents and the teachers both said that they noticed changes in health behaviour in the playground, but also in the classroom. And so they also told us some of the things we needed to think about in order to make sure this program was sustainable and scalable. And that's been really important to our next stage. So why am I telling you all of this? The other thing that we have been really successful, and we've had acknowledgement in 3 World Health Organization reports as an exemplar for how to address non-communicable diseases. And so we were getting, you know, this momentum, and we were doing a really great job. But when we went to the Tasmanian government and talked to the Department of Health, they were very clear with us that actually what we were doing sat better with education, so we should go and talk to them. And then we applied for funding and spoke to people in the education department, and they felt that perhaps maybe our work, you know, focused on health literacy fitted better with community sector, so we should go and talk to them. And we did manage to get a little bit of funding from the Tasmanian Community Fund to do a proof of concept in 4 more schools in Tasmania, which was wonderful. But what we were finding for, you know, the last 9 years is that our work was being put into unhelpful silos, and we were really getting shifted around from health to education and community. No one really wanted to own it. And what we thought about was, well, actually health literacy doesn't just fit in one or the other. And that was why my Churchill Fellowship came about, because I became really frustrated. And, you know, when we're passionate about something, it's important to answer that question. So my question then for my Churchill Fellowship was to ascertain if health literacy should be treated as a health, education or community issue. And depending on who I met with in Europe, I changed the or to an and. So sometimes there were people, you know, understood that it should be across the board, and it should be a health literacy and all policies agenda that we should be thinking about. And so I was very fortunate to receive the Churchill funding, which allowed me to visit colleagues in 9 countries in 8 weeks. And so I went on my way and met with many organisations while I was there. The Churchill was awarded in 2020, and all of you will remember what happened in 2020. So I didn't travel for another 2 years. So in the meantime, I decided, oh, well, I might invite some colleagues to write a book with me. So we produced a book called Global Perspectives on Children's Health Literacy, and each chapter is answering this question: is health literacy a health, education and community issue? And so the book is just about to be completed, and it includes 24 chapters and 19 countries. Many of the chapters I received in draft form before I travelled last year, so I was able to really understand what was happening on the ground in each of those countries before I landed. And yeah, I'm very, very grateful to all of the people that I met in Europe and how generous they were. And I think a lot of people realise that health literacy researchers, but also people doing health literacy work in community as well as policy work, are very generous and very keen to share and work together. So this is my Churchill Fellowship in numbers. So I met with 485 people in total in 41 meetings. I was very fortunate to be invited to the Dutch Health Literacy Alliance and present to them. They have over 150 member organisations, so they're a really large associational organisation and doing amazing work. As with all good research questions or questions, from my one question came 4 new questions, which I want to share with you. And some of these questions we're looking to write papers on to respond to these questions. I also came up with 6 recommendations, which I'll share with you in a moment. And when I got back, I contacted Don Nubbeam and said, Don, I really want to share my Churchill recommendations with you. And he said to me, well, they're great, but you need to actually put some practical solutions or recommendations alongside of them so that they can be actionable. Yes, and I only lost my luggage once while I was there. So that was great. So these images are just a quick snapshot of the trip. So here I am meeting the World Health Organization with Trinette Lee, who is the director of the Health Promoting Schools group. And I was fortunate to have a colleague at the last minute also invite me to meet with the director of the the social determinants of health and equity unit. So I met with Nicole, and that was an amazing meeting. And that was the day that I was flying out from Geneva to come back home after my 8 weeks of travel. And it was great. I was really academically stimulated by the people that I met there, and they really provoked me to think about things in different ways. And you'll see that when I share those emergent questions with you. And then the other images on the other side are from the Dutch Health Literacy Alliance work and the day we had there. And it was amazing sharing of knowledge, and we had workshops, but we also had the plenary presentation as well. So what was the answer to my question then? So, you know, what do you guys think in the audience? And feel free to put it in the chat if you want to. Is health literacy a health issue? Is it an education issue? Is it a community issue? Or is it an and? Who should take responsibility for it?
Got it. I suppose all of the above.
Yeah. So, my answer was yes, like health literacy is a health, education and community issue. And I met with the Public Health France group, and one of these quotes is, you know, health literacy really is everywhere. And when you think about people traversing their everyday life, health literacy is in the supermarket, health literacy is at home, it's in the, you know, it's everywhere. It's not just in hospitals or in the health sector. And so one of our workshop participants, I particularly like this quote from the Dutch Health Literacy Alliance workshop. First of all, it's all three. All three are necessary, but we need justice, health equity at the very base, and also as an umbrella to protect these 3 domains. So it really highlights that health literacy is that social determinant and has a really important role to play when we're trying to address inequity that we see in the community. And then Kirsty Visser from Oslo Met said, so I think that if all teachers and all public health nurses and health professionals leaving higher education know about health literacy, it might help to establish advocacy as a more central aspect of public health. And to be honest, like, you know, talking to colleagues in Europe, they're experiencing the same challenges that I was experiencing back in Tasmania. So it was both reassuring in so far as I wasn't, you know, having this battle or this brick head banging experience by myself. And it also showed me that we really need to work together as a global health literacy group to take on some of these bigger challenges and advocate for the importance of health literacy, the research being funded, but also programs in schools, for example, being supported by governments across the world. The other thing is, you know, this idea of advocacy, and, you know, for the public health people in the room, like it's a, you know, key part of our role, but so call it health literacy and advocate. A lot of people back in Tasmania were saying to me, health literacy is a term that people don't really understand, stop using it. And to that I say, well, I'm going to use the term and I'm going to educate everyone and make sure that people understand what it is. But I don't know if some of you realise it's really interesting that in Germany, the direct translation for health literacy is actually health competence. And I think health competence, and then in Denmark, it's health skills. Health competence and health skills, I think, it better encaptures what health literacy is actually about. I don't think health literacy for me is about just someone's ability to read a pamphlet. And so for me, I like that idea. Whilst I'll keep calling it health literacy, I think I like thinking about it in that more, full way, so the competence. And this, so Christine Sorensen was very kind and shared a lot of time with me. And she said this: I realised whether we call it capacity or empowerment, or it all comes down to this enablement and actionable competence. If you translate it, its ability to act, then we're talking about health literacy. But I would always call it health literacy. I'm not calling it all kinds of other things because I want to position it as a way to make change. And so that's a call to action for all of us, I think, which is, it's great. So the recommendations from the Churchill are, we need to think about health in all policies. So that needs to be on the agenda. We need to invest in health literacy development in schools to ensure the next generation are equipped with the assets that they need. So Olivia and Fiona in that onion can thrive no matter what. And also, this was from Nicole, the director from the Social Determinants of Health and Equity Unit. She said to me, well, Rosie, all of this work that you're doing is wonderful, but if Australia doesn't subscribe to a health and wellbeing economy, it's all futile. And so I think it's really important to think at a policy level, can we challenge and push as health literacy researchers and also working in policy on this agenda? And one of the things that I said to Don when I got back from the Churchill is maybe health literacy could be used as a really important indicator, a measure or an indicator for when we're looking at the health and wellbeing economy. I'm mindful of the time, Kirsten.
I think you've got another 10 minutes.
Okay.
Keep going, and then we'll pause for questions.
Okay. So this was the first recommendation from the Churchill, and that was that cross-sectoral coordination, multi-sectoral funding, strategies to overcome these silos, and encouraging staff to work across departments or portfolios be required. That may already be happening in Sydney or New South Wales, I'm not sure, but it's certainly something that we can do better in our Tasmanian departments. And then I've got a set of practical solutions there as well, which I'll show you how to access the report later, but they can be all accessed there. The next recommendation was this idea of a health and all policies approach being required to support health literacy development in schools, so that then all the sectors, so health, community and education, come together to collaborate and ensure that health literacy is being developed in our schools. So a lot of our research tells us that teachers are not doing it, particularly in Tasmania. They don't feel confident or competent. And so they do need support in order to elevate health education in the curriculum and make time for it. But not only that, ensure that health education translates to health literacy development. Because at the moment, it's not always being done in that way. And I think that's a missed opportunity. We see examples in Finland where it's very much part of the curriculum and health literacy is being supported. The development of health literacy is emphasised. But maybe that comes back to that left way of thinking and that whole idea of a health and wellbeing economy and society really subscribing to that in those countries. So recommendation number 3 is more research and agreed measures or methods of assessment of children's health literacy will be essential. So a lot of work's being done in the adult space and, in adolescence, but in children, it's very difficult to measure children's health literacy. We do know that there are tools that have been designed for adults and then adapted for use in children, but I would argue that that's not always appropriate. And I don't think we should be using a tool that was designed for adults to measure a child's health literacy because their context is so different and the things that their everyday life is different. We've got a PhD candidate at the University of Tasmania working on this idea of assessing, from the teacher's point of view, assessing a child's health literacy. And so we hope that that might be, you know, a contribution to the field and help us to move forward in this space. Recommendation 4 is around teachers requiring that training and resources, so that professional development, so that they can be confident and competent to support the health literacy development of our next generation of children. And then recommendation 5 is that child and adolescent health literacy development will require advocacy, champions, social capital and change theory in order for it to be implemented effectively. And then this final recommendation is that shift towards a health and wellbeing economy for the sake of the environment. And as I was writing my Churchill report actually in June last year, the government handed down the wellbeing framework, but that is the first step, I guess, isn't it, towards a health and wellbeing economy. But the framework alone, I don't think is going to achieve all that we want it to. And so the importance of health literacy could be recognised more broadly by society, I believe, if there's greater focus on health and wellbeing. And so given health literacy is a social determinant of health and can influence educational attainment, productivity and health outcomes, I believe it should be considered as an indicator for health and wellbeing economy. So these were the emergent questions. Remember I said to you from that one question, I came away with 4 new ones. So these are the 4 questions that I wanted to share with you, and then I'll wrap up. So how are health promotion, health education and health literacy related or different? That question's already evolved with the group that we're working on that question. So the second one is, how does health literacy influence behaviours, and does it always? How does health literacy address inequity and epistemic injustice? And then finally, could a wellbeing economy be the answer to health literacy being valued? So that's the landing page for Health Lit for Everyone. Our social enterprise that, as I said, is evolved or derived from our research at the University of Tasmania. And if you wanted to access the Churchill report, you can access it in that way. And whilst you're there, you know, have a look and think about whether you feel like applying for a Churchill Fellowship yourself if you've got a topic that you want to explore further. And thank you. Thanks for your time. And any questions?
Thanks so much, Rosie. That's so fascinating. We've had a few questions online, so I might just go to those first. Jacqueline, you asked an interesting question earlier. Do you want to turn on your mic and ask that question?
Sure, I think my mic's on. Can you hear me?
Yes, brilliant.
Okay. So yours is it's fascinating, and it's all around like grassroots educating information. But of course, my mind goes back to the COVID and the health literacy that was very much strongly in our face at that stage, and how much misinformation and disinformation then sprung up around that. And that now it's like a disease that stays with us. So how do you meet that challenge around misinformation specifically in your health literacy thinking?
It's a great question. So I don't know if I've had to personally address it in my research as such. When COVID hit, to relate back to COVID and health literacy, when COVID hit in our schools that we'd been working with and we've developed action plans with, some of them quite purposely moved their focus area to social and emotional health. So they recognised that the children were isolated and needed more support in that way. So they were exploring developing the children's health literacy assets to respond to that. And it was really nice, we as public health practitioners understand that our health is more than just our physical health. It's our physical health, our mental health, our emotional health, our social health, our cultural health, our spiritual health, environmental health. And so for me, it was really reassuring to see that the teachers took that next step and saw that relationship between mental health, which they'd covered in their first year, but then when they were, put into COVID times, that they then shifted their focus and used emotional and social health as a focus for that school. And they were providing the children with opportunities to develop these toolkits, so these coping strategy toolkits, and the children worked on developing their resilience and their, how they feel connected and supported during that time. And then the whole purpose of the artifacts or the creative pieces and the work that we did in the schools was to have that gentle backwash effect into the household, so that then they'd share the artifacts and the health messages and the learnings from their that was age appropriate to those children with the family, and sort of became like a ripple effect across each community or school that was working with us at that time.
That's a nice term, backwash effect. I like
Yeah.
that. I haven't heard that before.
Yeah, I'm sorry if I haven't answered your question directly, but yes, misinformation and disinformation is a real issue, and I think, particularly for children and adolescents who are using a lot of social media platforms. I have just been talking to a professor here at Sydney University yesterday about doing some more work in New Caledonia, in the Pacific region, but also in Australia, looking at this idea of the intersection between health literacy, digital literacy, and in between, I imagine that they cross over, that digital health literacy, and that's, becoming more and increasingly important for our adolescents.
I've got a few more questions online, and then I'll go and see if anyone in the audience. Emma, do you wanna unmute yourself and ask your question? Karen? No, I can. No, if I don't hear you, I'll read it out. Okay, I'll read it. So this is from Emma Kemp. I have a question regarding how health literacy is most commonly measured overseas. Here in Australia, you often see the HLQ being used, but that's quite a long measure. And I'm interested to know of alternatives or adaptations that you came across.
Yes, great question. So the European health literacy measurement tool has been adapted, and they've got lots of different versions of it. I'm not sure, Emma, if you've seen the health literacy. There's a what's it called? There's a health literacy resource that you can go to and look at all the different tools that are available.
The toolkit.
The toolkit.
Toolshed. CDB toolshed.
Yes, the toolshed.
The health literacy toolshed. Health literacy now hosted by TUF.
Now hosted by Tufts. So health literacy toolshed hosted by Tufts. And
That's right.
Emma's having microphone difficulties. So
Okay. But there's groups in Europe that have been working on the MOHLA, MOHLA collaborative or consortium, and they, all keen to see all of us using the same health literacy tool. And I spoke to Orkan, who's leading that work, when I was in Germany, and he was explaining to me that the way they envisaged that tool would work is that depending on the country, so there'd be a core set of questions for health literacy, but each country then would adapt and pick and choose additional questions based on their culture and context, so that way that it's more flexible. Because, as I was saying before, there's so many definitions of health literacy, but also health literacy is so culturally and contextually informed. So using a tool that's been developed in Europe for Europeans may not be appropriate for us to do here in Australia. But I think that this idea that the guys, the MOHLA consortium, have come up with is wonderful, and it would be great. I mean, I don't know, there's a lot of debate about whether we want league tables and people comparing across countries, people's health literacy, but in some ways it is helpful to have those measures, so we can champion to government and say, well, this is where we're sitting, and this is why we need to do more work in this space.
yeah, absolutely. Thank you. That's really helpful. And there's another question here online, and then I'll see if anyone in the audience wants to ask a question. Okay, I wish to know the emergent. Oh, sorry. Actually, Jeremy, you might want to ask your question yourself. Sorry, I was about to read it out, but I'm just going to see if you want to unmute before I do that.
Hi, thanks for the invitation to reiterate the question. I don't have much of a voice because of a cold. So I wonder if you could read the question out
Yes,
for
I'll
me.
read it out.
Thank you. Thank
Thanks
you.
for your question. So I wish to know if the emergent questions are informed by young people's perspectives. Are you working with Tasmanian youth advocacy groups or young community members, and how might you prioritise which ones needed to be addressed first?
Okay, first question. The questions did come or did stem from my focus on children, but I guess they are broader than that. A lot of them are kind of looking more at a policy or at a higher level, I guess. The other question about working directly with the children. So in the schools we have, that's a very important part of our programming, that we have Health Lit for Kids Heroes. And I have been talking to the Commissioner for Children in Tasmania about our work, who's very supportive of what we're doing. And yes, the next step may be for us to work more closely with some of the children's groups. I've been advising to the COCO group in Austria on a piece of work for them about how we can involve child voice and children and adolescents in research more appropriately. And that paper is being submitted currently. So there'll be some insights and, you know, best practice around that in there. Hopefully that's answered your question.
Thanks. Yes. Thanks, Rosie. Does anyone have any questions in the audience? Danny.
I do. So I have two questions, but we can. So my first one was, could you share with us a little bit about,
Speak up, Danny.
what the components of Health Lit for Kids are? Because I think I once read there was kind of skills development and focus on kind of skills for kids, but also organizational level changes within schools. And I think that would be really interesting to hear about, if you wouldn't mind.
Yes.
And also, like, I think related to that, you've also mentioned like digital literacy. I feel like there's so many now literacies that people are kind of to tackle. How has Health Lit for Kids kind of gone about that?
Yes. Okay, great question. So I'll just take us back to this. So this is helpful because so when we developed the protocol, we went to the international literature and we did a scoping review, and we saw there were some key things that we needed to think about in the development of the program. That was a whole of school approach, and that's, you know, in line with the health promoting schools agenda. So we took a whole of school approach, and we encouraged the school to use a tool that we had in Tasmania at the time. So this is back in 2017, the Hello Tas tool, which was used by community organisations to look at their health literacy responsiveness. And so we had to adapt and use the tool and do some translation for the teachers at the time to use that tool. We've since been working very hard to develop a school-specific health literacy responsive tool, and we're just about to start a Delphi on that to finalise that piece of work. So it was important to us to acknowledge the role of the whole school in creating that nurturing environment and the supportive environment for the students so that they could develop their health literacy. So that was, you know, really important to us. So we have 3 workshops over a 12-month period, and the first workshop was all around the whole of school. And we even went to the trouble of asking each school, how do you define health literacy? We didn't give them our definition. We asked them, how do you define health literacy? What does it look like, feel like, and do in your school environment? And so that was important to get the teachers to buy into the process and own it. And then we worked with them to develop an action plan at a whole of school level. And then the second workshop dropped down and got the teachers to think, well, with that all in mind, you guys have outlined that action and your goals for your whole school. What do you want to do at an individual classroom level? And so we encourage the teachers to use the Australian curriculum, health and PE theme areas, but also to cross across multiple parts of the curriculum to develop lesson plans so the children could develop their health literacy, but develop their health literacy using that image or definition of health literacy that local school came up with in their action plan. And then we ran a final workshop at the end of the year, and most of the schools had a expo, so they were giving the children an opportunity to do that citizenship, health of self and others, advocacy, and they got to share these creative artifacts, which was a culmination of that term of learning. this, scope and sequence of the learnings that the children have had over a full term to develop their health literacy assets on a specific, health topic. And to be honest, most of our schools went with mental health. That was the first. Food and nutrition and the health benefits of physical activity. So they were the main kind of areas that the teachers seemed to focus on. So they were it dropped out at 2 levels, and we do have a protocol paper that's got the program and how it all worked, and also that emphasis on the whole school as well as the individual assets of the children. There was a second question, which was...
Well, it's quite a long question. So I don't know much about health and wellbeing economy, and so I wondered if you could just share a bit more about what that is and what that means.
Yeah, so, well, a very short answer to it is, rather than focusing on gross domestic product and GDP and how much money we can make and grow as a, economy in Australia, being more focused and putting more energy or investment into health and wellbeing, and seeing that as a priority. And, some would argue, like, in the countries where it's more left in their thinking, that they're already doing that quite well. And others argue that, well, if we did that, it's kind of like the climate change argument. If we did that, if we invested more in the health and wellbeing economy, that productivity and the GDP thing will follow naturally anyway, because people are more healthy, more productive, experiencing less inequity. Yeah, so yeah, I guess we'll wait and see whether the government can enact it, the framework.
It's not just the framework, it's a set of actions and whole system change, isn't it?
Yes.
Are there any other questions in the room or online? I've got a couple, I guess, to see if anyone else puts their hand up. Talked about teachers' assessments for the students, and I just wondered what those might look like, or were looking like for the students, and how you kind of evaluate them if that student has achieved health literacy, and where that, where you end up with that.
Yeah, it's a great question. Yeah, so we've been really fortunate to have Claire Otten, who's a school nurse, a nurse and also a teacher by training. And she came to our research group as a research assistant some years ago. And her PhD's been exploring this idea, and she's done a lot of theoretical thinking and looking, and her idea is to almost have a rubric. So those of you that do teaching at the university, be familiar with the idea of a rubric. So the rubric acknowledges Beam's three levels: the functional, interactive, and critical health literacy, but it also acknowledges Picari and Picari's components as well. So she's sort of lined them up. And what she's suggesting is that the teachers could assess, so those artifacts, for example, that I described, like the culmination of the children's learning against this rubric. So the children's work pieces could be assessed over time to assess their health literacy development.
Right. Okay, so the students submit their work, and then it's judged according to this sort of matrix of achievement of competencies or skills.
So like competency-based education sort of thinking. Yeah.
And just one last question. You started off talking about the silos, which was just really fascinating, because we've been doing some work on the National Health Literacy Strategy, and if you talk to people in government themselves, they are also frustrated that it's very difficult for them to work across departments. And I guess with your Churchill Fellowship, have you had any response? Have you taken it to government? Have you had any feedback from them? Can you share any more insights on where we can go with that? Because it's a fundamental problem and block to having this, to enacting health literacy everywhere for everyone in every kind of sector.
Yeah, great question. My big goal is to the Churchill Foundation have another program that I can apply to called the Policy Impact Program. So this year I'll apply to that, and that provides me with a microphone to our federal government, so I can request to meet with them and share the recommendations there. locally in Tasmania, I have shared with we have a health literacy network group, and so I've shared with them, and they do have members of the Department of Health and Public Health as part of that. And I have met with some of our ministers in Tasmania and shared with them. We haven't had a lot of traction yet, but I have said, this might be, you know, a bit political, but I've said to the Tasmanian, the people in the ministers in Tasmania, it would be really disappointing if we weren't seen to be implementing some of my recommendations that were born out of, you know, work from Tasmania first before the federal government starts to enact them. So I'm trying to put a little bit of pressure on them to be, you know, to motivate some change. Yeah.
I've got a last couple of minutes. Are there any other questions? Can we just check if there are any more questions online? Oh, great. We've got one last question. Thanks, Chris. Go for it.
I was just wondering, like with all of your travels, you're 8 weeks away, you're in 9 countries, you're 19 different organizations or groups that you met with. Was there any particular center or country or some program or whatever it might be that was an exemplar to anything that you just thought really stood out, that if you could take it, act it, or make it big, anything that really struck you?
Yeah, well, it was really interesting because we started around the same time as my colleagues in Germany, so Orkan and their group, and they are doing amazing work. And he sat back and he looked at what we've achieved and we've been doing down here in Australia or in Tasmania, and he was in awe of what we've achieved. But at the same time, I was looking to him and thinking, well, these guys have done an amazing job, but they had €4 million to implement some of the work that they wanted to do that was very similar to us at the same time.
And I bet you didn't have a 10th or even
No.
100th.
We had about 100,000 Australian in
Yeah.
total over the last 9 years to do all of what I've shared with you. And so, yeah, but we've got a lot of heart, so we believe in what we want to do. So he impresses me very much. Like, he's an amazing supportive colleague. And he said, when I met with him, you need to make sure all of the work you do now is mainly focused on health literacy. Don't be distracted by other things. The other thing that he's done, which is an amazing achievement, is he's been awarded a World Health Organization Collaborating Centre for Health Literacy. And so I'm super keen to stay in touch with him and organise some exchanges for PhD candidates and hopefully in time postdocs between Australia and Germany to his unit. So he and I are exploring, there's a grant that you can apply for, the Australian-German grant through the federal government. So we're exploring the idea of applying for that this year. And I hope that, yeah, we can organise some mobility and movement between those two through Australia and Germany, so we can keep sharing knowledge and building in this space. So yeah, if that's something that some of you guys are interested in, we'll hopefully make that happen.
Great. Well, look, I think that now takes us to time. Thanks, Rosie. Thanks very much for a really fascinating description of your really interesting work. And look forward